Breast cancer is one of the most common cancers in women worldwide, and it develops when abnormal cells in the breast begin to grow uncontrollably, forming a lump or tumor that can invade surrounding tissues or spread to other parts of the body. Medically, its main causes are linked to genetic mutations, especially in BRCA1 and BRCA2 genes, hormonal influences, such as prolonged exposure to estrogen through early menstruation, late menopause, or hormone replacement therapy. Family history of breast or ovarian cancer, increasing age, certain benign breast conditions, obesity, alcohol use, radiation exposure to the chest, and lifestyle factors, while some rare cases are related to environmental exposures or previous breast diseases, and although breast trauma can cause pain, swelling, or hematomas, it is not recognized as a direct cause of cancer because cancer fundamentally starts at the DNA level within cells, where damage to genetic material, either inherited or acquired, leads to uncontrolled growth. In the context of physical contact, such as a man touching, fondling, or pressing a woman's breasts, churna, or chaki marna, there is no scientific evidence that normal sexual touching causes breast cancer because the cancer process is not triggered by simple external pressure or stimulation of healthy breast tissue, and while rough or repeated trauma could, in theory, cause chronic inflammation, fibrosis, or fat necrosis, which may form lumps that mimic cancer on scans. This does not mean they transform into malignancies. Most such lumps are benign and resolve over time, though chronic injury can make clinical examination more difficult by masking or mimicking real cancer. That being said, sexual touching by itself does not alter the hormonal or genetic environment enough to initiate cancer. And breast cancer risk is determined more by long-term biological and genetic influences rather than short-term mechanical contact. It is also worth noting that certain infections like human papillomavirus, HPV, and viruses under study may play a role in some breast cancers, but these are transmitted through different pathways and are not linked to breast fondling. Medically, a more relevant connection between men's behavior and women's breast health is the role of partners in encouraging regular breast self-exams, supporting mammogram screening, and helping detect unusual changes early, because early detection is the most important factor in reducing death from breast cancer. Warning signs include a painless lump, nipple inversion, discharge, especially bloody, skin dimpling, redness, or swelling that does not go away, and these require prompt medical evaluation. Prevention strategies focus on maintaining a healthy weight, limiting alcohol, exercising regularly, avoiding unnecessary hormone therapy, breastfeeding if possible, which lowers lifetime risk, and knowing one's family history to decide if genetic testing is appropriate. While breast fondling or chaki marna in a consensual and safe sexual context is medically harmless for cancer risk, any rough or harmful act causing repeated injury should be avoided not because it will cause cancer directly, but because it can cause painful injuries, scarring, or confusion in diagnosis. Thus, from a scientific standpoint, breast cancer is a disease driven by cellular-level genetic damage and hormonal factors, not by normal physical contact, and public awareness should focus on evidence-based risk factors, regular screening, and early medical care rather than myths about sexual touch causing cancer, because such myths distract from the real, preventable, and treatable aspects of the disease.